Hi, this is Lyn Pollard. I'm a parent contributor for the National Center for Learning Disabilities, and today I'm going to wrap up the Everyday Decisions series with this last installment, which is about helping kids with learning differences and special needs feel really comfortable in medical situations like doctor's visits, dentists, the orthodontist, and different things like that. I think that this topic is pretty universal to all parents, but it's especially helpful for kids, parents of kids that have anxieties or trouble with attention or different issues like that that come sometimes when you have learning differences and different special needs like autism or dyslexia, or especially I'll talk a little bit today about having sensory perception challenges as well, because a lot of times that comes into play when you're in like an uncomfortable physical situation like at the doctor or dentist's office. So I'm just going to basically share a little bit. I'm going to expand on a little bit of a story that I talked about in today's post in the blog, and I'm going to talk a little bit about my advocacy for my son who has some challenges that he had at his orthodontist office and how I advocated for him there. And so basically, what happened was of course, whenever we looked into what orthodontist we were going to use, we looked around and compared and, considered pricing and, the personality of the orthodontist and especially location. We found a place that's like half a mile from our house, which is great. And didn't spend a whole lot of time thinking about kind of like the layout of the actual orthodontist office, which is what came into play when it came to my son's needs. And so during, I guess, his second visit, he was getting some work done on his mouth, and he was starting to get really sensitive. My son has a lot of sensitivity, like in his neck and his mouth especially. I think a lot of kids that have sensory processing disorder or challenges have maybe some specific areas, like maybe it's their feet or maybe it's, an area around their face that they're really sensitive. That just happens to be his more sensitive area. And during the appointment, as he started getting more into like inserting his appliance and doing different things that they were working on, he just started to get more and more upset. And I quickly realized, I looked around the room and realized, oh no, I should have been more thoughtful about choosing an orthodontist or looking into different ways that an orthodontist could serve my child. And the setting was basically, our orthodontist office has a sports theme. And so the room where he works on all the patients is this big open like stadium kind of layout. It's like this big horseshoe area with all the seats, chairs where you do the orthodontist work in like a semicircle, and then behind it are little stadium like bleachers that the parents sit in. It's really cute the way it's set out, and there's a big screen TV like in the middle that shows sports, and so it's a really cool layout, which is one of the reasons we like the orthodontist. But I quickly realized, and I think a lot of orthodontist office have kind of an open layout like that, which is common. But I realized as we got more and more into his appointment and he got more and more uncomfortable, he started, vocalizing it and getting louder and kind of being upset and crying. And it quickly became the kind of situation that wasn't ideal for anybody. It wasn't ideal for my son. It wasn't ideal for the other patients that were waiting. It wasn't ideal for the person that was working on his teeth. It just wasn't ideal. So basically, I got up and, stood with them and tried to, comfort him and talk with the nurse. And we kind of went through some different ideas and of ways to make him more comfortable, but nothing was really working. And so finally what happened is I just had to kind of just like put on my advocacy hat and really just kind of have to stand up for him and just said, we're just going to have to stop, just stop. And we did. And basically I just said, could I speak with someone about some options for my son right now, because this isn't working and I just really need to figure out something that's going to work for him. And so long story short, basically what happened is I ended up getting to talk with the office manager. And at first she was a little bit kind of resistant because I think she didn't really know what my approach was going to be or what my attitude was going to be. And but I think as soon as she realized that I was, approaching it with a collaborative nature, and I just said, here is what I feel like we need. What can you offer me? How can we work together to come to a compromise? And I think compromise is really kind of the theme of this particular advocacy event, and that's that, they basically said, well, why don't we offer you an appointment where he can come in early next time before the office opens, where he won't feel uncomfortable being in a crowd. He won't have anxiety because of kind of people sitting in the stadium, literally bleachers, watching him be upset, which just, wasn't fair to him. And they offered us this early appointment. And although it wasn't what I really wanted him to have an after school appointment in a private room. I compromised and agreed to do that. So what was really great about it is that, we were able from then on, I felt like, we had kind of established this rapport, and then they were able to always provide that accommodation for him, to be aware of the fact that he needed a special circumstance. But it also opened up this great dialogue between myself and the office manager about kids with differences. And, I said, I really appreciate how kind you've been. I just want you to understand, parents of kids with differences advocate for their kids all the time. I didn't even think about needing to advocate or think about what he needed here in the orthodontist office. And it might just be good for you to, to be aware that parents aren't always coming into these situations thinking ahead. And maybe you could kind of, based on their medical history, if they have something like autism or, learning disabilities or different things on there that, or sensory processing especially, maybe you could think ahead and maybe even offer them some of those accommodations ahead of time so they wouldn't have to think through it. And she said, oh, that's so great. I'm so glad that you're mentioning this. This is definitely something we need to be more aware of. And I'm actually going to even talk to the doctor about maybe setting up a private room as well for the future, because I think that might actually be the best idea. And so it was just a really great conversation. And I felt like, just from then on, that she, not only had I helped my son, but every time I came in, I kind of felt like, she just kind of understood us and just had a kind of, I don't know, we just felt like we kind of had a special relationship because we've been able to go through that honest conversation. And so the last thing I just wanted to share about this kind of episode in my advocacy journey is that, one thing to keep in mind whenever we're in these difficult situations, it's not easy to kind of stand up and have to kind of go against the flow and make people kind of feel like you're kind of being that mom. I know parents in our situation often feel that that's kind of this pressure between, I just want things to just be normal and having to just kind of like, do what you need to do for your child. I think that it really helps to, think about the focus and about your attitude. Is your focus about, just your own child and just kind of about that moment and about just kind of making sure that, that in that second that, everything is working well? Or is it, is your focus more about, advocacy for all kids with learning differences or disabilities? Like, in other words, is the time that you're taking right now to point out something, not just about you or, being selfish about just kind of like this one moment? Is it actually your attitude about thinking about, if I speak out now and I raise awareness of this issue in my orthodontist office, then the next time a kid with special needs or learning differences or something else going on comes in, what I'm doing now is laying the foundation for this office to be more accommodating and more accepting to the next child. And so that's something that I always try to think to myself. And obviously I'm not perfect. There's been moments in my advocacy where I'm just like, you're just angry and you're just doing what you have to do at that moment. But I think that for me, like kind of keeping that perspective as it's not just about my child. It's not just about me. It's not just about our family's comfort or needs. It's about, kind of like going out into the world and being, I guess, like an evangelist is a word that you hear people use a lot. But, just like, raising awareness of the fact that, these kids have stuff going on. They're just like any other kid, but sometimes they just need something a little different or a little extra. And there's nothing wrong with that. And you're not complaining and you're not trying to make a fuss. You're just trying to make sure that your child has an accommodation that they need in order to just get through life like every other kid. So, anyway, so that's just basically what I wanted to share. And I think it's a good way to kind of wrap up the series and just to encourage you that, throughout this series, we've talked about a lot of different like everyday things that everybody faces. And in no way, our kids with differences, they don't, deserve anything above or beyond what other kids deserve. They just deserve to have an equal, same shot at the same things that other kids get to do. And sometimes that just means that they need to have these accommodations. And so that's something that I think is really important to keep in mind as you kind of go through your journey as a parent advocate or a parent of children with differences. It's just that, that you're only providing for your kid exactly what every other parent wants to provide for their kid, which is, just to have the best opportunities and the best experiences that they possibly can. So that's it for today. And thank you so much again for tuning in to the Everyday Decisions video blog and to the blog series. And hopefully I'll get the opportunity to be with you guys again in the future. Thank you so much and take care.